At any moment, the U.S. Senate will take a test vote on the Republican-backed health care plan. You're watching Capitol Hill Live, where that will take place. They say that their health care plan promises to make medical coverage more affordable. Immediately after that test vote, they will do the same on the Democrats' health care proposal. The Republican plan lets Obamacare subsidies expire and replaces them with fixed payments into health savings accounts. The goal, to make sure health care is cheaper for taxpayers. Democrats are pushing for a 3-year extension of those subsidies. So in other words, keep it really expensive, keep what you've got in status quo, aiming to cover more people without cutting federal spending on health care. So the sides are different. The plans are up for consideration today. Here is a snapshot of the debate.
Obamacare robbed the American people of choice as well as affordability. Democrats are interested in making them even richer. What they're proposing isn't a serious plan.
Our bill is the last train to leave the station. After wasting precious time fighting among themselves, Republicans have one last shot at a clean, realistic plan to lower health care premiums. The Democratic bill is the only bill that will do that today. The Republican plan is a when you get sick, you go broke plan.
From Politico now, the longest government shutdown in history was all for this, and that was the man who caused it. That's who led it, Chuck Schumer. A Democrat-led vote in the Senate this morning on extending Obamacare subsidies that we already know is going to fail. The GOP alternative, bolstering health savings accounts, will also get a vote today. And yes, it too will fall short without bipartisan support. Each side will then blame the other for blocking progress. Chief Congressional Correspondent Chad Pergram, this is the worst case of a dog chasing its tail.
Well, it's also about the math, and both plans need 60 yeas. That's why they likely fail today. Senate Minority Leader Chuck Schumer, he ripped the GOP plan on health savings accounts, and he says Republicans are deeply divided.
Republicans have had so many differences amongst themselves that for a while it looked like they weren't going to put up a bill at all. But after that became too embarrassing an option for Republicans, they used Scotch tape and glue to come up with this ridiculous proposal.
So after the votes fail, one of two things happens. The sides will end their political posturing. Then they may get serious about preventing a spike in health care premiums. A deadline before Christmas often boosts efforts like that. Or the sides conclude they're stuck and cannot solve anything. Bipartisan lawmakers say they want to do something.
I think that we have it within our own body to come up with a bipartisan plan, but it would require them to work with Democrats. Are they willing to do that? I haven't seen evidence so far.
GOP Pennsylvania Representative Brian Fitzpatrick has a plan to temporarily extend the Obamacare tax credits. It's a gambit to go around House Speaker Mike Johnson.
There's a lot of people who are very concerned about Obamacare and the fact that the subsidies were created by Democrats for COVID-era limited use and they want to be extended. We just can't get Republican votes on that for lots of reasons, not enough of them.
But the Fitzpatrick maneuver needs Democratic buy-in. It will not ripen for weeks. This means that premiums will skyrocket. Still, the GOP worries about talking affordability but not addressing it before the midterms. And we're looking at the floor right now. Mike Crapo, the Senate Finance Committee chairman, is talking. We think that that vote should start probably sometime in about 5 to 10 minutes. All right.
Chad, thank you very much. That's minute by minute from you. Appreciate it.
Hey, everyone. I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.